Good afternoon, everyone. I'm hoping that you can hear me. So if you can hear me, if you can hear me online, does someone just want to turn on their video and just give me a big wave and say, yes, you can hear me? Yes, that's great. Thank you so much. We're just waiting for people to arrive in person here, so we'll be starting in a minute. But just to let you know what we're going to do in this session, we'll be doing some breakout rooms for about 10 minutes in the session. So make sure that you're ready to do a little bit of interaction. But it's lovely to see you all here today.
Thanks, Jen.
Thank you so much. I've just sent everybody online. I'm hoping that you've received it in the chat, a handout for today's session. So I would just like to welcome everyone to this session. The session is on securing funding for research studies in health professions education. And this session draws heavily on a book chapter that I wrote in a book that I wrote on health professions education research. Now, I realize not everybody joining the session does health professions education research, but the principles are still the same. So over the next just under an hour, we'll work through practical evidence-based approaches to writing a compelling research proposal. Whether you're new to this area or you're transitioning into this area, we'll give you some concrete tools and strategies to use. So this is an overview of the session. So by the end of the session, you should be able to identify funding sources, both local and international, that are relevant to your work in Sri Lanka. And you'll understand the three phases which I use and others use to do proposal development, preparing, drafting, and reviewing. You'll be able to draft a proposal with clear conceptual frameworks, which is often the biggest challenge for those coming from clinical backgrounds. And you will recognize common errors and how to avoid them. And you'll also have a systematic checklist, and you'll see that in your handout, that you can use to appraise your own proposals and those of your colleagues. I want to start with this quote from Thomas and Hodges. Preparing a research proposal is arguably the central creative act underpinning the development of new research. And it reframes how we should think about proposals. They're not just bureaucratic hurdles, they are, or just even funding applications, they're creative, foundational aspects of your research. A well-crafted proposal sets the entire project up for success. So before we dive into the funding landscape and writing strategies, let's acknowledge the multiple purposes of research proposals. So yes, applying for research funding is one purpose, but it's not the only one. First, writing a proposal forces you to focus your thinking. When you put your ideas on paper, you quickly discover the gaps in your logic or the feasibility of the issues that you are undertaking. Secondly, writing a draft gives colleagues something concrete to critique. Verbal ideas are hard to evaluate. Written proposals can be improved on, and everyone can have a look. And thirdly, you need proposals for ethics approval, whether from your supervisors or, or the ethics committees. And fourth, of course, is funding. Fifth is a detailed proposal serves as your roadmap during implementation. When you're deep in data collection months later, it keeps you on track. You can just go and check back to it. And finally, it serves as an audit document when the project is complete. So even if you're not seeking external funding, or if you're not successful in your funding, but your research still goes ahead, writing a thorough proposal is really worth the investment. So I'm going to take a quick look at the funding landscape, but before I do so, I'm just going to I'm going to have a look online. I'm also going to ask the room as well. Has anyone here already, and give me a show of hands, have you already undertaken a research proposal, a grant proposal where you're asking for funding, or is this the first time? So show of hands, have you done this before? Yes? How about online? Do you want to put your little hands up on I think you can put your hand up on the screen. Let's have a look. I can't see any. Can you see some online? I'm not sure. I'm sure that some of you online have done this before. I'd be very surprised if not. Okay, well, no one's raising their hand. Never mind. Just gonna minimize it so that I can see what I'm doing here. Okay, so let's take a look at the funding landscape for researchers. And I've primarily looked at this from health professions education researchers, because that's what I am. But also just a bit of a heads up, I have included things for clinical researchers, but I'm not an expert in this area because I don't come from Sri Lanka. So I have had someone take a look at these slides and they've said, yes, that looks okay, but there may be others that I've missed. So let's just go ahead and take a look. So let's start with local and national funding sources in Sri Lanka. The National Research Council offers investigator-driven research grants for public sector researchers. Applications are typically, they open early in the year and they evaluate based on scientific merit, relevance to national development and publication potential. So when you look at these, you've got to really think about, when you do your application here, where am I going to publish? How relevant is it to Sri Lanka? And how good is the science in this, which is where peer review comes in. University Grants Commission allocates funding through individual universities. So your first step would be you should check with the institution's research office about what's available internally. And the Ministry of Health has research funding programs. Although you'll want to verify current schemes, depending on your focus. So if you're a health professions education research, specifically, you want to verify that you can get some funding for that. And the Sri Lankan Medical Association offers research awards and grants for medical researchers. So the key tip here is don't overlook internal university grants. They are smaller, but they are less competitive, and it can provide some seed funding for later, larger applications. So if this is truly the first time that you've ever applied, that might be where you want to go to give yourself a head start when you're applying in a very competitive external environment. Now I'm looking specifically at grants for health professions education. So in terms of health professions education, AME, which is the Association of Medical Education in Europe, they have grants specifically for health professions education scholars in resource constrained settings and developing countries. It covers teaching and learning assessment and curriculum development research. FAMA is another place. It has regional institutions, 4 in India, plus programs in China, Egypt, Indonesia, and Uganda. And these are fellowship programs with embedded research projects. They focus on faculty development and leadership in health professions education. Now, the Wellcome Trust offers international masters fellowships and training fellowships for low and middle income countries, and their Africa and Asia programs focus on capacity building. And the NHI Fogarty International Centre is significant. They have mobile health technology grants up to $850,000 over 5 years. They also have emerging global leader awards and research training grants. And Sri Lanka is eligible as a low middle income country. So if you're thinking about doing something that's even bigger, you might want to go there. I've included the URLs in your handouts, so you should be able to access them better. So that's my bit on where you might find your research funding. But do you know what? I think you need to be creative. Sometimes industry funds research in the health sector. So you may have industry partners more widely in the university. So I suggest you speak to people who will know about that a little bit higher up. And also, I would say we all know Gen AI. We could go to ChatGPT or Claude and ask whether there's any kind of like intel happening on the internet as to where you might get funding. So be specific and say exactly what you're looking for. There should be funding opportunities available nationally and internationally. And if you have any international colleagues, certainly reach out and see what can be done through other countries. So we're going to move on to the core question, which is the 3-phase approach to proposal writing. It's fine to know where you're going to get your research funding from, but unless you've got a really, really high quality proposal, you are unlikely to get your funding accepted. So this framework comes from Blanco and colleagues' works and provides a systematic way to develop high quality proposals. We'll probably spend about 20 minutes on this section, and we'll cover preparing, drafting, and reviewing. So phase 1, all about preparing to write, the groundwork before you draft a single sentence. Start with reading the literature. Consult a librarian. Particularly think about doing a systematic search, and we had a session a couple of days ago on systematic research. Look for published reviews as a starting point. Systematic reviews in open access journals are especially useful. theory hunting is crucial. And this is where clinical researchers, if you're doing research in health professions, education spaces, find it particularly difficult. You need to identify the relevant theories that speak to what it is you're looking at, to the phenomenon that you're studying. In health professions research, that section isn't optional. It's absolutely essential that you think about the theoretical perspective in which you are working. It is absolutely expected. The other thing to do is build your team thoughtfully. Ensure that in your team, you've got a breadth of experience and expertise. Consider including someone, if you're doing health professions education research, who already understands health professions research, that have that expertise if you're new to the field. Know your funder. Contact program managers directly with questions. Seek insights from previous awardees. So if you know someone who has already been awarded a proposal through that certain funder, then have a word with them and say, look, can I see your successful application? You know, get to know what a successful application looks like, so you can see exactly what works. And plan really early for ethics. Become familiar with how you do your submissions locally, the processing, deadlines, you know, and for multi-site research, contact the committee early. And engage with your broader community. Talk to each other about your ideas. Go to conferences, engage on social media. This dialogue can help develop your thinking. Okay, phase 2 is drafting. So let's start with the writing style. Health professions education research proposals, particularly, are typically written in the future tense. So active voice and first person, singular or plural. So while some disciplines like a passive voice and a third person, education researchers, this field has moved towards active voice and the first person pronouns. Why? Because it really underscores the subjective nature of interpretive research, if you're doing interpretive research, but it also, whatever research you're doing, it acknowledges your involvement. It doesn't talk as if no person is involved. It talks as if you are the people involved. And clarity is absolutely essential. Write clear, concise sentences. So avoid long sentences with lots of commas. Keep it short. Avoid or explain technical jargon. Pretend you are writing for a non-expert. One of the things that I find really tricky, and I really don't like at all, is acronyms. Acronyms drive me crazy. And everyone talks in acronyms as if it's a word. You know, it's like, you know, the SPAR or something like that, you know, the HPE and the URS. And I'm sitting there thinking, you might know what you're talking about, but I don't. Even in writing, my recommendation is, if you have an acronym that's got less, three initials or less, write it out in full, because the person who is reading your proposal, you may define all your acronyms and then put them in a bracket, and then halfway down the page, the reader's forgotten. They go, what is it? I'm completely confused. I have to keep going back. I'm sure I'm not the only one. So write it out in full where possible. So here we have a before and an after example. The first version is reasonably jargon heavy. So it says a qualitative lens informed by socio-cultural perspectives of learning activity was used to focus on how academic literacy was infused into the lecture. The second version is a bit clearer. Socio-cultural perspectives maintain that social interaction plays a fundamental role in developing understanding. Using participant observations, we will explore qualitatively interactions between teacher and students that facilitate students' acquisition of literacy skills. So the second version explains the theoretical perspective before stating what the researchers are going to do. And consistency matters too, especially when you've got multiple authors that are writing your application. You know, someone who's not involved in the project, get someone new to read it for consistency. You know, I would write very differently to the way you would write, but you need it to have a single authoritarian voice. So these are the typical components of a research proposal. We won't cover all of them in detail, but I've highlighted component 4, the conceptual and theoretical framework, because for health professions education researchers, and those new to it, this is really important. But all of the other components are super important, of course. Your title page. Make sure that your title's not too long. You know, really consider the clarity of information. Sometimes, and I'm going to talk about this on the next slide, sometimes your proposal might be almost rejected at the title and abstract stage. And that's quite scary to think of, but it actually, you know, does happen. So I'm going to have a quick word about titles and abstracts. It's the first thing that readers see. And you know what, we think about first impressions. You know, everyone says, oh, first impressions really count. It's true with your research applications too. Your title is the first thing they'll see. It needs to grab people's attention. It needs to include key features of your study, the phenomenon, what is it you're studying, the study design, the participants, and the setting. So here's an example, the impact of COVID-19 pandemic on teaching and learning in health professions education, the mixed methods study protocol. So you can, it's all in there. It tells you what, it tells you who, it tells you how, all in one title, and it's not too long. I love the colon. The colon is your friend. You can put the detail, you know, confusing stuff at the beginning. With a colon, you can clarify how you're going to do it. For abstracts, you all know, with those of you that have written an abstract, this is not the first thing that you write, it is the last thing that you write. You write it once your proposal is complete. You structure it as a problem statement, a need for research, purpose, design, methods, implications. Now, the interesting thing about the abstract, I don't know about you, but from my perspective, sometimes I actually write the abstract. I write an abstract first, but I don't put it in the document because I write what I'm intending to write. Just having a look to see if okay, I was looking to see if there was anything in the chat that people wanted to question. Yeah, so I tend to kind of write the notes of what it is I'm hoping to do, but the actual abstract in the document needs to be written last. Again, avoid acronyms in the abstract they frustrate readers who don't know your field and are not familiar with your shorthand. And, you know, I would question once more the need for using shorthand at any time. The thing about your research proposal is when you submit it to a funder, you may not necessarily have someone who understands your field fully assessing it. You will likely have at least one expert, but you also may have someone in the field who is non-expert. Thank you. Okay, your introduction, it sets the stage and it justifies the importance. You need 4 essential elements. So first of all, a problem statement. What are the key features? What are the causes of the problem? And what has been done? Second, a critical literature analysis. And this is crucial. It's not a summary of studies. It's a critical analysis that highlights gaps and what research is needed. You need to, when you report the studies that you see, you need to say something about, you know, what they overlooked in that study, what the gaps were, what the problems with the studies were. And hopefully your study is going to overcome these. Third, your proposed statement, your purpose statement, which should follow logically as the necessary next step. Paraphrase your research questions here. And fourth, the significant, social and educational importance, who will benefit. After reading your introduction, reviewers should be convinced that your team has complementary expertise and that the problem is worth addressing. Now, there is in health professions education research a structure called the problem gap hook. And it's possible to use it in any area of research. And the problem gap hook is a single paragraph that comes up first. And in that single paragraph, it does what the whole of the introduction will do in depth. It's like an abstract paragraph for your introduction. And in that paragraph, you want to be saying, state really clearly what the problem is. State really clearly, you know, in 1 or 2 sentences, state really clearly in 1 or 2 sentences what the gap is, and really clearly in 1 or 2 sentences what you are going to do to address that gap, and then go in depth to actually address each of those issues in turn. The reason I like it, and the reason it is very successful in health professions education research, is that people are lazy. Even your reviewer who's going to review your study for a research funding, I'm sorry, but they are busy and they are not going to read in depth. You need to capture their imagination first up. So if you can put all of this into one paragraph, a powerful paragraph that makes the reader know, this is great. This is good. At least you'll get them reading the rest of your introduction. They won't skip through it. Okay. The biggest challenge, now we come to the critical section on conceptual and theoretical frameworks. Now, I do realise that some of you are not doing health professions education research, but there will be some theory behind what you're doing. You will have some hypotheses, some you know, there'll be some, you know, even if it's a clinical theory about, you know, why what you're doing you think is going to work. And it's really, really important that you include this. It's the biggest challenge for clinical researchers coming into a social research space, because health professions education research is social research. But a proposal without a clear conceptual framework will struggle in health professions education research. A proposal with a clear conceptual framework will be brilliant in a clinical space. So these terms are often used interchangeably, like, conceptual framework, theoretical framework, but a conceptual framework is the justification for why your study should be conducted. It's a tentative theory informing the rest of your design. So it's that whole rationale about why it's important. A theoretical framework articulates the logic of why a particular theory is being used. So you build your conceptual framework by employing existing theories that speak to your phenomenon, conducting a critical synthesis of the literature, and reflecting on your own experiences with the phenomenon. A thoughtful conceptual framework helps you assess and refine your goals, develop relevant research questions, select appropriate methods, and identify potential alternate explanations to your conclusions. Okay, so this is an example from an educational study. It was in the book chapter that was in the book that I wrote. So it's Sacker and colleagues. And they used a pedagogical content knowledge, that's PCK. See, acronyms are really bad, aren't they? As their theoretical framework in their grant application. They defined the theory clearly, explained why it was appropriate to their context, and acknowledged that it was originated in school education rather than health professions education. So what they did well was the theory serves in multiple purposes. It frames their research questions, it guides their data collection tool and the content representational tool, and it informs their analytical approach. So the key insight here is bringing ideas from outside of your traditional field to strengthen your proposals. So they borrowed from school education to illuminate health professions education. So methodology and methods. This is the how of your research. You need to address the study design, your research questions, your context description, your participants and sampling, and data collection and analysis. But what distinguishes high quality proposals is the internal coherence of your thinking. Internal coherence means that your epistemology, your methodology, and your methods all align. I'm going to explain that very briefly because I'm guessing that there'll be a number of you who have never heard the term epistemology. Has anyone here heard of the term epistemology? Okay. Epistemology is how you get to know about knowledge. Epistemology is your internal logic about how can I know what I need to know. Now, so the epistemology essentially relates to your methodology. So if you want to know about people's experiences, your epistemology would be that there is no single truth, because your experience of something is very different to your experience of something and your experience of something. We all experience aspects of the world very differently. So if you're interested in participants' experiences of something, then your epistemology is that there are multiple truths. You won't be able to do a statistical analysis on it. You have to get deeper and you have to understand, which will drive your methodology. So your methodology might be interviews. Okay, so that would be one thing that you would do, or focus groups. But if you think that people can be put into different buckets and everyone can be compared, like males versus females, or what have you, and we can do a statistical analysis on this, then neuroepistemology is that there is such a thing as a truth, and that we can find it. And we can find out the difference between males and females by putting them into different categories and analysing them statistically. So we can then, in our methodology, we can measure their experiences by asking them to tick a box, which will translate into a number, like on a Likert scale, and that way we can actually statistically analyze two groups. Does that make sense? So you need to be really clear about what you think, and the internal coherence between, you know, your intention and what you believe you're going to find, and your methods and your methodology need to be really, really clear. You also, so reviewers will notice the proposals that lack an internal coherence. So if you're looking for viewpoints, so you say, we would like to look at patients' viewpoints on this clinical intervention that we are going to do, or students' viewpoints on this educational intervention, and then you put in a questionnaire and statistical analyses, it's going to look very odd. So you need to be really clear. So you need to demonstrate the feasibility of your research. So timelines and budgets are a really good way to demonstrate the feasibility. For timelines, a Gantt chart is really useful. Who's heard of a Gantt chart? Yeah. If you haven't, look it up. It's an easy way to look at the timeline. But make sure that you allocate sufficient time for each phase. Account for unexpected events, ethics approvals delays, participant availability changes. And some fundings will require that you do a risk analysis. So you've got mitigation strategies. A Gantt chart that looks like everything's going to go smoothly, I'm sure that you all understand, if any of you that's done any research at all, you know it never goes smoothly. You know, oh, this will take us 3 months, and then it takes you 5 months. That's because something happened here, or even a researcher got sick, and, you know, or we couldn't recruit, or, you know, the emails went out too late, and we missed an opportunity. And all of these things shove the timeline a week and a week and a week. And if you don't have a risk analysis that you've done, and you haven't shown that you've got sufficient, kind of overestimate the time rather than underestimate it. If you haven't done that, a reviewer of your research funding application will pick that up. It's one of the most common things that reviewers of grant applications pick up, that you've been overly optimistic, you haven't demonstrated that you understand that lots of things are going to happen. So risk analysis is a really good tool to have. And it shows your understanding of the complexity of, you know, what research is about and how you are prepared for challenges. What if this happens? Well, we'll do that. For budgets, you need to know what is fundable and what is not fundable. So go to the guidelines and search. Sometimes researcher time isn't included. Sometimes it's just expenses, or it's research fellows who you will employ, but not you yourself as a clinician or an educator. So you need to find out exactly what it is. Contact the funder directly if you're unsure about specific items. Work with your research office. Everyone's there to help you. Be realistic in the budget. Again, an unrealistic budget, too low or too high, is a massive red flag for a reviewer. And reviewers have been known to really bring down a research proposal on the feasibility and, around timelines and funding. So common budget items include personnel, if you're doing qualitative research, transcription services, software, participant incentives, travel, and even catering if you're doing in-person events. And phase 3 is reviewing your proposal. I would argue this is so important. Get feedback from experienced researchers who can assess the appropriateness and soundness of your application. Get feedback from non-experts, like potential end users of your research, who can assess the clarity of your writing. If a non-expert cannot understand what you have written, it is not clear. A useful professional development activity, serve as a reviewer for conference proposals, or even serve as a reviewer for research funding applications, if you can do that. It gives you an idea of the other end, what it's like to be on the other side. Exposes you to proposals across the quality spectrum, and it gives you insights into what works and what doesn't. So you read something and you say, oh, that's bad, we better not put that in ours, it doesn't read too well here. Use a systematic checklist. All sections present, are they all logical? Is the purpose clear? Is the justification convincing? Is there a strong conceptual framework? Is there internal coherence? Are the timelines and budget feasible? And I've included a full checklist in your handout materials. Now, we started late, so I don't think we've got much time. I don't really think we've got time for our hands-on activity, which is a shame, but we did start a good 5 or 6 minutes late. So we will skip the hands-on activity because I think it's important to get questions, have time for questions at the end. Okay, so we're on to the final part, which are common errors and how to avoid them. So the final section is about common errors, and we'll probably spend about 5 minutes here, and then I think we'll have 5 minutes for questions. Okay. Okay, so here are the most common proposal errors that I've seen and that the literature documents. First, missing or weak theoretical frameworks. And this is the most common issue for clinical researchers entering health professions education research. Theory must be explicit. For those of you who are clinical researchers, maybe theory may not be there, but certainly your conceptual framework, the rationale as to why what you're doing should work is super important. Secondly, summarizing rather than critically analyzing the literature. Your literature review must identify gaps, not just describe what the studies have done. So don't just do a laundry list of what the studies are and what they've looked at, but you must critically engage with them, pull them apart, and all, really insert your own, think about what you're doing that's going to address what they didn't do. Why is your work super important? So by summarizing rather than critically analyzing the literature, you really miss a trick. Your literature review should identify the gaps and not just describe what studies have done. Okay, third, internal incoherence, where epistemology, methodology, and methods don't align. And we've talked about that. When you say what your intentions are, and in your research question will tell you what your philosophy of knowledge is, and whether you believe there is a single truth or multiple truths. And that's a basic element. And then you must make sure that it follows through your methodology. So make sure it's internally coherent. And fourth, unrealistic timelines and budgets. We've just talked about that. Underestimating time for ethics, recruitment, and analysis. Those are the common ones. Fifth, unclear research questions. There are so many times I have read research proposals, that have been submitted for funding that don't actually say, our aim is, our research questions are. So make sure you're really super explicit. Make them specific, focused, and answerable. And six, seems obvious, but it happens often, is not following the funder guidelines. Every single funder has specific requirements. You should read them and follow them precisely. I mean, an absolute minimum, you should be knowing exactly what the funder wants from you. Okay, so the 5 key takeaways. 1, a good proposal enables successful research. Invest time up front, especially in phase 1, the preparation phase. Get yourself a decent team, make sure all of your bases are covered, and make sure that you are already prepared. You know what the funders want before you start writing. Number 2, make sure the conceptual framework is in there. It's your argument for why the research matters and why it should be done. So don't skip that. 3, internal coherence. Make sure everything aligns in your study. 4, multiple funding opportunities exist, local, regional, and international. You're not just limited to one source. If you submit, and I would say if you're early career or you're new to an area, look internally first. Look at small amounts of funding. Do a feasibility study. Do something small. Get yourself a reputation. Dip your toe in. Don't go for the big ones first, because you're unlikely to get funded if you go for the biggest ones first without a track record. And also reach out to anyone that you know nationally and internationally to see if they know, and make sure you search the literature. And 5, feedback. Feedback is your friend. Get feedback early, get feedback often, get both expert and non-expert reviewers, which will add value to your work. Here are some recommended readings to continue your learning. These are in your handout. These are mainly for health professions education researchers, and I know that some of you are not, but there are takeaways you can have from these that will also be applicable in your area. I think we're done. We're over time now. Thank you very much.
Absolutely. Thank you once again for your valuable time that you took to educate us who have joined physically, as well as many doctors who have joined the Zoom. And I'd like to thank all of you who have participated in this session as well. So thank you very much, Kelaniya.
Thank you.